Hey, it's Dr. Jim. Thank you for spending some time with me on another interesting topic in aging, in psychiatry, geropsychiatry, behavioral health, mental health, you name it. My topic for you today is dementia and co-occurring psychiatric disorders. Okay? So allow myself to introduce myself as well as this topic. New findings in the neuropathophysiology relationship between psychiatric disorders and dementia are shedding light on a number of areas, including predictors of dementia, psychosis in dementia, the impacts of psychiatric disorders on dementia, and clinical management of older adults with both psychosis and a dementia-related disorder. Wow, that was a lot in one big sentence. The vast majority of long-term residents, elderly folks living in skilled nursing, assisted living, memory care, a lot of them have at least one psychiatric disorder, which calls for more training and education of nursing home staff, a multidisciplinary approach to care, and a number of interventions to address both conditions, dementia and some type of psychosis, while maximizing quality of life. Big topic, got to pull some parts out of here and really explain. Let me discuss the scope of the problem in dementia and co-occurring psychiatric disorders. Over 3 million residents in long-term care are diagnosed with Alzheimer's disease alone, and hundreds of thousands are either diagnosed or undiagnosed with other dementia-associated illnesses. They are yet to be diagnosed. This also means that over half of all residents in skilled nursing facilities around the country have dementia. On top of this, between 65 to 78% have at least one identifiable psychiatric illness, including mainly anxiety, depression, and insomnia. Other psychiatric disorders likely to accompany dementia include the following, based on research: adjustment disorder, bipolar disorder, personality disorder, delusional disorder, schizophrenia, and schizoaffective disorder, combining both the cognitive as well as emotive, behavioral elements of the illness. There is a rise in prevalence of psychiatric disorders in skilled nursing care. It's reported, and it's been reported for some time now, that there is both a high and growing prevalence of psychiatric disorders among residents living in skilled nursing facilities across the country and around the world. Many residents with dementing illnesses also experience secondary psychiatric disorders like those: adjustment disorder, bipolar disorder, personality disorder, delusional disorder, schizophrenia, schizoaffective disorder. So, all in all, this adds up to more suffering for the resident and the family, and more stress for caregivers. What's the connection between dementia and psychiatric disorders? This is an interesting area. In many studies, it's been shown that psychiatric disorders, this is important, psychiatric disorders often precede cognitive decline associated with many dementing illnesses. Which comes first, the chicken or the egg? Which comes first, psychiatric symptoms or dementia? What we're finding is psychiatric symptoms come first. Interestingly, you might remember this. I remember learning this in Gerontology 101 as a freshman in college. Does this name ring a bell? Emil Kraepelin. The year is 1899. And 1899, okay, described a condition he called dementia praecox. Does that name ring a bell? Which was later called schizophrenia and had hallmark symptoms of cognitive disintegration, hallucinations, and delusions. It appears that depression is associated with an increase in risk for developing dementia in later life, and this risk increases with the severity of depressive symptoms, admission to a psychiatric hospital, and one of the more difficult disorders, bipolar disorder. Interesting. So I'm talking to you today, talking about dementia and co-occurring psychiatric disorders, like it's a newer thing, like, okay, this goes back a few decades or 20 or so years. No. The beginning of this research and observations on this topic goes back to 1899. What are the impacts of dementia with psychiatric disorders? Why? Why should we care about this particular topic? Well, in long-term care, the psychiatric signs and symptoms get more attention than dementia. For the most part. Why is this? It's due to the distress, unpredictability, and disruption that psychiatric symptoms bring to the residential setting. So the psych and behavioral are getting more attention than the cognitive and the dementia-related symptoms or signs. Psychiatric disorders mixed with dementia can exacerbate and cause greater caregiver stress, anxiety, and burnout, not to mention a huge problem in skilled nursing today, senior care in general, staff turnover. More time and resources are also spent on residents who exhibit a lot of psychiatric and behavioral signs and symptoms. Of great concern are the ultimate impacts: severe cognitive and functional disability, and a faster progression from severe dementia to mortality or death. Here are my final thoughts, and you're probably saying, thank you, on dementia and co-occurring psychiatric disorders. Like my video, share my video, enjoy my video, send it to other people who might enjoy it. And then I have a special invitation for you after this video. It's clear through much research that dementia co-occurs with many psychiatric disorders. In other words, they occur at the same time. Mainly anxiety, depression, and insomnia, but there are many more. The nursing home population is growing significantly, and more than half of residents living in them will be diagnosed with dementia already or will soon be diagnosed with dementia, and at least one psychiatric illness. Staff, they're going to have to be aware of diagnoses, develop person-centered care, and be prepared to deliver high levels of care and quality of living for those residents who have both dementia and some type of psychotic illness. So thank you for your time and attention. Give me one more minute. If you are interested, if you're a licensed healthcare professional or you just want to keep learning, I have a wonderful website and a wonderful service online called CEU Academy. The web address is ceu.academy. Go there. You can buy courses, bundles of courses, an entire annual subscription for yourself. Most of the courses you could watch online, on a computer, laptop, tablet, cell phone. They're streaming videos, and they're approved for CEUs. So administrators, nurses, social workers, case managers, activity professionals. Check it out. Take a pre-test, watch a video, complete a post-test, fill out your eval. Up comes your certificate of completion for continuing education hours. Thank you so much. I'm Dr. Jim Collins. Please keep coming back for more good information and insights from me.